Breaking the common myth of cleaning the arteries. Many people believe that clogged arteries can be cleaned the way a greasy water pipe is cleaned. Just eat a special food, drink a certain juice, or do a detox regimen, and the plaque will dissolve, wash away, and restore the arteries to their original open state. This belief sounds logical, simple, and full of hope, but biologically, it's incorrect. Human arteries are not smooth plastic tubes. They are living tissues with complex structures, constantly interacting with the immune system, cholesterol particles, and inflammatory processes that unfold over many years. Plaque inside the arteries is not a soft layer of fat that can be rinsed away. It is the result of a long-term chronic inflammatory process in which cholesterol becomes oxidized, immune cells infiltrate the vessel wall, and fibrous tissue gradually forms. Because of this misunderstanding, much of the advice circulating on social media, from lemon water and apple cider vinegar to various superfoods, ends up creating false expectations. When these methods fail to produce clear results, people often assume they didn't try hard enough instead of questioning whether the underlying assumption was correct in the first place. The problem is not a lack of effort. The problem lies in how we incorrectly imagine the nature of vascular disease. To understand what can truly help protect or improve arterial health, we first need to abandon the idea that this is a simple mechanical issue. Instead, we must see it as a complex biological, immune, and metabolic condition. Only when we understand this reality can we accurately judge which solutions are grounded in science and which are merely attractive promises without a solid foundation. And that is why, before discussing any specific food or nutritional strategy, the most important step is to correct our understanding of arterial plaque from the very beginning. A cardiac surgeon's perspective, what you never see online. After many years working in the operating room, cardiac surgeons have an advantage that very few people do. They get to see the inside of human arteries directly, not through illustrations, charts, or 3D models, but with their own eyes, real arteries from real patients. What surprises most people when they learn this is that arterial plaque looks nothing like a soft layer of fat or dirt that can simply be scraped away. In many cases, the arterial wall becomes thick, rigid, and completely loses its elasticity. Some segments even feel almost like porcelain or stone due to years of progressive calcification. Because they see this reality every day, cardiologists and cardiac surgeons are naturally very cautious about claims that arteries can be cleaned with a single food or a simple trick. This isn't pessimism. It's an understanding that vascular disease is the result of long-term biological processes, not something that can be reversed in a few weeks. Another crucial insight from clinical experience is that the danger of plaque is not determined solely by how much it narrows the artery. In fact, many heart attacks occur in people whose arteries are not severely narrowed. The main culprit is plaque instability, when inflamed plaques become fragile, rupture easily, and suddenly trigger blood clot formation. This is a point that much popular online information overlooks. People tend to focus on widening the artery while forgetting that the core problem lies in chronic inflammation and immune activity within the vessel wall. If these two factors are not addressed, cardiovascular risk can quietly persist, even if imaging makes the artery appear more open. From this real-world perspective in the operating room, doctors understand that protecting arterial health means targeting the underlying biological mechanisms, not chasing quick, surface-level cleansing solutions. What plaque really is: not fat, but an inflammatory response. One of the biggest misconceptions about cardiovascular disease is the idea that plaque in the arteries is simply fat buildup. In reality, plaque is not an inert lump of fat. It is the result of a complex inflammatory reaction that directly involves the body's immune system. The process usually begins when LDL cholesterol penetrates the inner lining of the blood vessel. LDL itself is not the main problem. Trouble starts when LDL becomes oxidized. At that point, the immune system recognizes oxidized LDL as a threat and immediately responds. Immune cells, especially macrophages, move into the area to clean it up. But instead of resolving the problem, macrophages engulf the oxidized LDL and turn into lipid-laden cells known as foam cells. Over time, these foam cells accumulate and form the core of the plaque. At the same time, the body tries to patch the inflamed area with fibrous tissue and calcium, causing the vessel wall to thicken, stiffen, and lose elasticity. What's crucial to understand is this: plaque does not form over a few months. It is the result of many years of silent inflammation, often progressing without obvious symptoms. That's why many people feel completely healthy until a sudden cardiovascular event occurs. Seen from this perspective, focusing only on reducing fat or cleaning the arteries is not enough. To truly affect plaque, we must understand and address inflammation, oxidative stress, and how the immune system responds to cholesterol. Action comment number 1. Did you used to think arterial plaque was just fat buildup? If yes, comment inflammation to remind yourself that heart disease is a problem of inflammation and complex biology, not just fat. The development of atherosclerosis. Silent steps over many years. Atherosclerosis does not happen suddenly. It is a gradual, step-by-step process that unfolds quietly over many years, often decades, before it manifests as serious disease. Understanding each stage of this process helps explain why prevention and early intervention are so critically important. The first step begins with damage to the endothelial lining, the thin, delicate layer of cells that lines the inside of the arteries. Factors such as oxidative stress, high blood sugar, high blood pressure, smoking, or chronic inflammation can make this lining less tight, allowing LDL cholesterol to penetrate the vessel wall more easily. Once LDL enters the vessel wall and becomes oxidized, the immune system is immediately activated. Macrophages are recruited to the area to deal with the oxidized LDL. However, when this process continues repeatedly, macrophages become overloaded with lipids and transform into foam cells, which accumulate progressively within the arterial wall. Over time, the body attempts to isolate the inflamed area by forming a fibrous cap around the plaque. This is a natural protective response, but it also causes the vessel wall to thicken and lose elasticity. At this stage, the arterial lumen may not yet be significantly narrowed, so symptoms are often absent. In later stages, calcium begins to deposit within the plaque, making the artery increasingly stiff and brittle. At this point, the problem is no longer just narrowing of the vessel, but also the loss of normal arterial flexibility, forcing the heart to work harder to pump blood. The most dangerous aspect of atherosclerosis is not simply the gradual growth of plaque, but the moment when plaque becomes unstable. An inflamed, fragile plaque can rupture and trigger the formation of a blood clot within minutes, leading to a heart attack or stroke, even in people who previously felt completely healthy. Because atherosclerosis is such a prolonged and complex process, understanding how it develops is the foundation for choosing strategies that truly matter in protecting cardiovascular health. Why plaque is most dangerous? When it ruptures, not when it narrows the artery. When people talk about atherosclerosis, many assume that danger only appears when an artery becomes severely narrowed. In real clinical practice, however, the degree of narrowing is not the sole or even the most decisive factor behind major cardiovascular events. What matters far more is the stability of the plaque. A large number of heart attacks and strokes occur in people whose arteries are not critically narrowed. The reason is that an inflamed, thin, and rupture-prone plaque can be far more dangerous than a larger but stable one. When a plaque ruptures, the body reacts as if it is facing a serious injury. At the moment the plaque breaks open, the clotting system is activated. Platelets rapidly gather to repair the damaged area. Inside an artery, however, this response can quickly form a large blood clot that blocks blood flow within minutes. This is the direct mechanism that leads to an acute heart attack or stroke. What makes this especially frightening is that the process can happen suddenly, without clear warning signs. A person may feel completely normal for years until an unstable plaque unexpectedly ruptures. This is why many serious cardiovascular events occur in people who were never previously diagnosed with heart disease. The key takeaway is this: focusing only on widening the artery or reducing the percentage of narrowing seen on imaging is not enough. What matters more is reducing chronic inflammation, improving endothelial health, and making plaques more stable over time. Only when we understand that the greatest risk lies in plaque rupture, not just in how narrow an artery looks, can we properly appreciate the role of lifestyle, nutrition, and biological factors in protecting long-term cardiovascular health. The flaw in the traditional treatment approach, focusing only on narrowed segments. For many years, the common approach to treating atherosclerosis has focused mainly on how narrow an artery appears. When imaging shows a significantly narrowed segment, the usual solution is to place a stent or perform a mechanical intervention to open up blood flow. These interventions can be life-saving in emergency situations, but they do not always address the root of the problem. The mistake lies here. Atherosclerosis is not just the story of a few narrowed spots. In reality, plaque can be scattered throughout the entire vascular system. Many plaques do not cause severe narrowing, yet they are highly unstable and prone to rupture. These dangerous plaques often go unnoticed because they don't stand out on standard imaging. By focusing only on fixing narrowed segments, we may unintentionally ignore the chronic inflammatory process silently affecting the entire arterial system. A stent can improve blood flow at one specific location, but it does not eliminate inflammation, repair the endothelial lining, or prevent new plaques from forming elsewhere. Another critical issue is psychological. After an intervention, many patients feel that the problem has been fixed. As a result, they may neglect foundational factors such as lifestyle, nutrition, and inflammation control. This can create a false sense of security while the overall cardiovascular risk continues to exist beneath the surface. This does not mean modern treatments are wrong. The problem is that they should not be the only strategy. For long-term cardiovascular protection, we need a broader perspective, one that focuses on plaque biology, chronic inflammation, and the overall health of the vessel wall, not just a percentage of narrowing. Action comment number 1. Did you used to think that simply opening up a narrowed artery was enough to solve heart disease? If yes, comment not just narrowing to remind yourself that atherosclerosis affects the entire vascular system, not just a single spot. The only mechanism by which the body clears cholesterol. Reverse cholesterol transport. If plaque cannot simply be washed away, does the body have any way to deal with cholesterol trapped in the vessel wall? The answer is yes, but only through a very specific biological mechanism known as reverse cholesterol transport. This mechanism does not work by aggressively breaking down plaque. Instead, it allows the body to gradually extract excess cholesterol from cells within the arterial wall and transport it back to the liver, where cholesterol can be reused or eliminated. The central player in this process is HDL, commonly referred to as good cholesterol. HDL's role is not to scrub clean the arteries overnight. Rather, HDL functions as a transport vehicle. It interacts with cholesterol-laden cells, especially foam cells, collects excess cholesterol, and carries it away. When this process works effectively, cholesterol accumulation in the vessel wall can slowly decrease over time, and plaques become more stable. However, a critically important point that is often overlooked is this. Not everyone with high HDL levels has effective reverse cholesterol transport. The quality and functionality of HDL matter just as much as its quantity. In many people, HDL is present but does not perform its transport role well, leaving cholesterol trapped in the arterial wall. This is why simply looking at cholesterol numbers on a blood test is not enough to fully understand cardiovascular risk. What truly matters is whether this reverse transport mechanism is active and well maintained. When it is impaired, cholesterol tends to accumulate, inflammation persists, and plaques become increasingly dangerous. The greatest significance of reverse cholesterol transport lies in this insight. The body does have a built-in capacity for protection and repair, up to a point, if the right biological conditions are in place. And this is the foundation for understanding why certain lifestyle and nutritional strategies can support vascular health. Not through magic, but by strengthening the very mechanisms the body already relies on. Why this protective mechanism gradually shuts down in many people. After understanding reverse cholesterol transport, a natural question arises. If the body already has a built-in mechanism to remove cholesterol from the arterial wall, why does atherosclerosis still progress in so many people, especially as they get older? The answer is that this mechanism does not automatically function optimally for a lifetime. Over time, multiple biological factors can weaken or gradually switch off reverse cholesterol transport, even when blood tests still show HDL levels within an acceptable range. One major factor is chronic low-grade inflammation. When the body remains in a persistent inflammatory state due to diet, stress, metabolic dysfunction, or underlying disease, the function of HDL can change. HDL is no longer an efficient transport vehicle, becoming less flexible and less capable of collecting cholesterol from the vessel wall. In addition, this process depends on specific transport proteins on cell surfaces, proteins that allow cholesterol to exit foam cells and attach to HDL particles. When these proteins work poorly because of aging, oxidative stress, or nutrient deficiencies, cholesterol remains trapped, even though HDL is still present in the bloodstream. Another often overlooked issue is HDL quality. Not all HDL particles are the same. In some individuals, HDL structure can be altered by an inflammatory and oxidative environment, causing it to lose much of its protective function. This helps explain why some people have normal or even decent HDL levels, yet their cardiovascular risk continues to rise over time. Lifestyle factors also play a significant role. Physical inactivity, impaired blood sugar control, and nutritional imbalances further weaken this entire protective system. When the body no longer receives the right biological signals to activate reverse cholesterol transport, plaque accumulation proceeds quietly and continuously. Understanding why this mechanism declines shifts our focus away from simply looking at lab numbers and towards supporting the true biological function of blood vessels. This insight forms a crucial bridge to the next question. Are there nutritional strategies that can help reactivate this protective mechanism? After understanding why arteries cannot be cleaned, the next important question is how the body actually protects blood vessels over time. Food does not work as a detox or a cleaning agent. Instead, it supports biological systems that control inflammation, endothelial health, and cholesterol transport. When this internal environment improves, excess cholesterol can gradually leave the artery wall and existing plaques become more stable. A key part of this protection comes from the endothelium, the inner lining of blood vessels, which depends on molecules like nitric oxide to stay flexible and resistant to damage. Certain nutrients help support this process. Olive oil polyphenols reduce inflammation, while vitamin K2 helps prevent calcium from hardening the arteries. These effects do not happen quickly. They require consistency, proper lifestyle habits, and the combination of many biological factors working together. There is no miracle meal for your arteries. Long-term cardiovascular protection comes from understanding biology and supporting it step by step.